Hello, everyone. My name is Tomar Shoval, and this is my partner, Roberto Rabinovich. We're excited to be at Money 2020 and present Simplee. So first, what are we trying to solve? What is the pain point? I would ask you all, if you don't mind raising your hand, how many of you understand your medical bills? Not a lot of people raising their hands. I'll ask another question. How many of you would like to know, before you get a medical procedure, how much it would cost up front? Sounds trivial, but not something that happens on a day-to-day basis in healthcare. This is the core of what we're trying to solve. Now, some of you may say, well, it's been screwed up for ages. Why now it's so important? In healthcare, there's a big movement and change that is happening in the last 5 years, and it continues to accelerate. Basically, more and more Americans are on high deductible plans, which means that the average family spends almost $4,000 paying medical bills, and that's on top of paying for insurance. Really, the motivation changes to understand that. On the other hand of the spectrum, when you think about providers and doctors, they used to get all of their revenue from the government and the different insurance companies. All of a sudden, they need to chase patients to make payments. Patients are not happy about that and confused about payments, not quick to open their wallets and pay, and therefore the providers have a huge collection challenge. Introducing Simplee Pay, which is a cloud enterprise solution that is designed to solve the problem for both the patients and the providers. And before I'll go into explaining the product and showing you a demo, allow me to share our exciting disruptive results with our charter client, a large North California community hospital. When we started working with them, less than 2% of their patients were paying the bills in a self-service fashion, meaning online or mobile. Everyone else sending checks, making phone calls to make payments and ask questions, or going through collection agencies. Very unpleasant experiences, takes a lot of time, and cost a lot of money for the provider. 6 months forward, since we started working with them, with our platform, over 30% of their patients are now paying in a self-service fashion, online or mobile, through our application. And of course, as this goes up, the traditional expensive collection methods have shrank, and that translates to over $300,000 of cost savings for the hospital. Really meaningful results. So how do we do it? Of course, our platform is touching the patient in any point that he can make a payment. And I'll focus now on digital engagement. So we'll start with email. We're leveraging emails, and it's not just sending one email that says you've got a bill. It's a platform. It's a thank you note when you leave the hospital and telling you what to expect. A bill is ready. An email that tells you that you need to take action. If you haven't done that, 7 days later, you get a reminder, a second reminder. Even a pre-collection alert just before the hospital is about to give up on you and send your bill to a collection agency, you're going to get another email that says, make the payment and avoid collection. Let's assume you clicked on that email. Very easy and smooth authentication. You don't need the paper bill in order to make a payment. You enter in, and you have what we call interactive beautiful bill. Just by glancing over it, you see that it looks radically different than a medical bill that you get home. We put a lot of efforts to building the right experience. Very easy orientation about who is it about, the date, the fact that it's been processed by the insurance company. We take the services names, we translate them to patient-friendly language, and most importantly, we integrate the explanation of the bill from the insurance company in the same place with the invoice. So we replace getting 2 papers, one from the doctor telling you to pay, and one from the insurance company tells you why, into one digital format. We get you to the point that you finally understand, ready to make a payment. You click on making a payment, and you can see that the average bill we put here, it's over $800, and it's not by accident. The average bill for healthcare can be $400, $450. Not a lot of people can just pay that up front. And what happens today is maybe you pick up the phone, you call the hospital, and you ask if they have a payment plan. We've built a payment plan mechanism for self-service that gives the patient the control to decide how many payments, how much money per payment, what's the day of the month that they want to make a payment. They save those settings and can activate their payment plan. And by the way, this is just the first initiative that we have under what we call convenience of pay. There's a lot more that is coming. We're actually looking for a deferred payment vendor that will help us introduce instant loans for bills that are above $1,000. Another powerful concept. Another thing that we're doing in the same context is prompt discounts. Pay in the next 24 hours, avoid collection, get 5% off. There's a lot of great innovation that can happen that will solve the problem for the patient. And speaking about innovation, another big part of our solution, solving that problem of really not knowing how much to expect that the payment will be, especially when you have a high deductible plan, we have a proprietary technology that creates an estimation, the same beautiful interactive bill, up front, pre-registration or at the point of service, and not just after the fact. We simulate what will be the actual bill, allow the provider to show you that on an iPad, on an iPhone, printed it out, or send you that in an email. Very powerful concept. Last but not least, let's talk about mobile, another big play. Of course, it's not a mobile app that's designed to give you a lot of hurdles. It's very smooth, HTML5 mobile experience. You authenticate yourself. You can go in, drill down, and see why you need to pay that $830, understand that, get to the point that you're ready to make a payment, and make a payment. Very smooth and easy, and can be integrated into a mobile app that a hospital has. One other important part of our grand vision at Simplee is we have our own B2C direct-to-consumer product that I invite you all to download the app or register online, which we call our Simplee Wallet. And the promise is, if you made a payment through our Simplee Pay platform to a single provider, and it was a great experience, we will then tell you, how about paying all of your providers using our application? And it works like Mint.com. You create an account, you tell us which are your insurance accounts, medical, dental, pharmacy, HSA. You give us authorization to have access to your data and your credential, username and password to your online account. We have a proprietary technology that instantly and automatically retrieves your data, and voila, you have a great dashboard that shows you your HSA balance and transaction, your deductible status for the family, for the individuals, how many open bills you have. So you can click and make payments to your family physician, your dentist, your next hospitalization. Very powerful concept. And also because we have access to your health information, your plan information, we can give you at the palm of your hand access to your plan information. So when you go to the doctor, you have a good sense of what is it about. That's it. Last but not least, just to kind of combine those two together, our B2B offering and our B2C offering. Think of Simplee Pay as our go-to-market. We bring value, immediate value to both patients and providers. At the end of that delivery of value, we can convert some of those patients who pay into our wallet offering, hopefully get a lot of scale, and eventually use that as a virtuous cycle to go back to more and more providers and not only offer them the best-in-class platform, but also offer them a lot of their patients that are already used to pay from a singleized location. Thank you very much.
That was awesome. Great job. Thank you. That was good. Nice job. That was great.